So this my topic is autologous blood donation and transfusion. Before going to the main topic, I will go to the normal functioning of the blood bank. Just in short, the human blood is covered under the definition of drug, hence is controlled, regulated by Drugs and Cosmetic Acts and rules thereunder. In the year 1967, central government enacted a separate provision in the Drugs and Cosmetic rules. Various requirements such as accommodation, technical staff, equipment, etc. for the operation of the blood bank were included in that part. Government of India published the National Blood Policy in the year 2002. The main aim of the policy was to procure blood from non-professional donor. Now, the requirement breakdowns in the rules to operate the blood bank as follows. The applications for grant or renewal of the license for the operation of a blood bank should go regularly. The processing of the whole human blood or components carried out under the active direction or personal supervision of medical officer along with registered nurse and blood bank technicians. The licensee shall neither collect blood from any professional donors or paid donors. The equipment should be, the blood bank should be properly equipped, including the emergency equipment as per, and that should be standardized and calibrated regularly as per the standard operating procedural manual mentioned there. Now, about the location and surroundings is also specified. It should be in the not in the unhygienic around the unhygienic area, and it should have an area of 100 square meter in addition to 50 square meter if there is component separation, with inclusion of the following rooms like registration and medical examination rooms, blood collection rooms, compound preparation room, laboratory for blood group serology room, where all this. Then next, blood transmissible disease PTD room, where the blood infections markers are tested. The sterilization cum washing room, refreshment cum rest room, and store cum records room. Written standard operating procedure must be available at every blood bank as per their requirement. About the collection, processing, compatibility. As per their collection, processing, compatibility testing, storage, sale or distribution of the blood, whatever activities are undertaken in the blood bank, the SOP must be maintained in the blood bank. Then the maintenance of the records, all records related to the blood donation and issue should be maintained, like master records, blood donor records, issue register, records of components supplied, then compatibility report, details of the recipient and the signature of the issuing person, records of the blood bags, and all these logistics, reagent kits, blood bag, etc. Now, the most important thing, that is donor selection. So, this is the, you can say, is very strictly maintained about the donor selection to avoid the complications of the blood donation and transfusion. The selection is based on the medical history, details with medical history, physical examination, and simple laboratory test. So, no person can donate blood in the following conditions if they are suffering and the donors are rejected. Like any patient suffering from cancer, heart, any chronic diseases like heart disease, hepatitis, nephritis, liver disease, or active tuberculosis cases, any abnormal history of bleeding, unexplained weight loss, suggestive, any signs and symptoms suggestive of AIDS, diabetes controlled with on insulin, rheumatic fever, except involvement of the non-involvement of the heart. Polycythemia vera, asthma, epilepsy, leptosis, schizophrenia, endocrine disorders, high blood pressure not coming to the normal even after 20 minutes of rest, venereal disease unless treated and negative serologically, any blood persons donated blood in the past 3 months, and persons under influence of drugs or alcohol. So these criteria are strictly maintained in day-to-day practice. Any persons on regular medications like antibiotics, corticosteroids, patients on anticonvulsants or tranquilizers, any vasodilators drugs, Then INH therapy, only after 48 hours stopping of the anesthesia can donate blood. Any anti-tumor agents or anti-pathogens or antidepressant drugs, anti-malarial drugs, etc. Now, the donors can be deferred temporarily. They can for a certain periods. These are already failed. So like persons with history of abortion are deferred for 6 months, history of blood transfusion deferred for 6 months, history of previous surgery for 12 months, history of typhoid for 12 months, history of malaria